He's a psychologist and a psychiatric social worker who's taken on everyone from teen gang members to grandmas in crisis.
She says Jamie is her savior.
Leslie, you know this is the rendezvous with destiny. I've talked to you about it.
Yes, I know.
You lost your wife. 47 years you were married. Scott's mother. This is the woman who said that Scott's going to die. Would you tell Scott that he can go and get well and get treatment and not worry about you?
I want him to.
Currently, Dr. Jamie delivers motivational presentations, specializing in mental health and caregiver challenges across the country.
I hear the tales, and I see the tears, and I hear the pain. I see people running into these burning buildings called your families, when many of the family members are actually running out.
Delivering messages from his book, Take Your Oxygen First, on topics such as caregiver burnout.
See, bearing witness might be the most wonderful thing we can possibly do. What is really that's listening. That's listening without trying to fix. That's actually going to a loved one and saying, I hear your pain, I empathize with your pain, I understand what you're going through. Actually taking care of others, we tend to lose ourselves. And in losing ourselves, we also tend to not take care of ourselves. So as soon as we start caregiving for a loved one, the next thing you know is we make that loved one our focus. We actually make that loved one number one in our lives. Caregiver self-esteem. Once you became a caregiver, I have to tell you, your self-esteem is really affected. You sometimes feel beaten down. You might have once felt you had good self-esteem. You might have felt you were a powerhouse one day. A lot of people I know were heads of companies, started nonprofits, did tons of things, and today they've taken care of their mom or their sister. And their self-esteem gets racked and rocked in the process.
In this vortex, in this energy, my fear was starting to dissipate. And since skydiving was one of my greatest fears of all my life, I started feeling kind of in sync, and then things started feeling better. And here I am.
Additionally, Dr. Jamie's an active columnist in Caregiver Magazine and Recover Magazine. Jamie has also written in a wide array of self-help and leadership books.
A couple of quick points before we say goodbye today. First, I want to thank Jamie again for his dedication and his sincerity. He has really worked tirelessly to help those of our guests who wanted help.
Thank you, Geraldo.
Thank you. You know what? Let's get something straight. We're going to have intergalactic travel here together for the next hour, right?
Yes, Jamie.
Okay. That being the case, there is a common denominator that puts Venus and Mars together, and we need to get that out right here now. And that is that both men and women ultimately want to be loved. That's ultimately their goal, is to be loved.
That's what's so hard about the therapy is you have to go back there.
Sure. There's no magic wand, Lisa, and I can tell you now that if you can't go back and grieve those losses, those traumas, then you really have a difficult time going on. And the recovery that Eddie has embarked on is exactly that task. It's actually going back to these losses in his life, the loss of a parent that he could trust, the loss of a life that he could trust, the loss of his childhood, going back and then going forward.
Health Corner is a sponsored program brought to you by Walgreens.
This is the most difficult decision any caregiver has to make. Hi, I'm Jamie Heisman. I'm a psychologist, and putting a loved one in a skilled nursing facility is rough.
We're seeing more and more siblings caring for a brother or a sister. Our co-founder and executive director, Dr. Jamie Heisman, is here with me. And Pat's story is lovely, but is that unusual?
It's a great story, but it's not that easy, Lisa. It really does come from challenging work to get to a place where siblings feel comfortable. You know, this caregiver or newly emerged caregiver that comes from a child that's disabled at birth is fascinating to watch. Oh, definitely. In fact, she's really made some sense out of a situation which I'm sure initially to her made no sense at all. They're there, present, ready for the wheelchairs, durable medical equipment, canes, and there's no one like Norm there. What a powerful service for a charity or association. Stopping you from taking that one day for yourself.
I don't even know how to begin to go there.
Would you be open for me to help you?